Hi, I'm Professor John Terry. I'm Professor of Biomedical Modelling based here at the Living Systems Institute at the University of Exeter. I'd like to introduce you to the MRC Skills Development Fellowship scheme and to highlight some of the many great things about holding your fellowship with us here in Exeter. A Skills Development Fellowship is a unique training fellowship. It's about identifying a biomedical or clinical research challenge and then creating a framework within which you can develop the skills you need to address that research challenge. The skills you are developing need to be in an MRC priority area, and here at Exeter our focus is on mathematics and mathematical modelling, statistics and computational modelling. The research challenge areas we are focused on here in Exeter are neuroscience and neurology, endocrinology and metabolism, and health services research and population health.
The focus of my fellowship is to study genomic regulation in early vertebrate development, and I'm also interested in identifying pharmaceutical targets for neurodevelopmental disorders.
The focus of my research is using computational models of cardiac electrophysiology to study ventricular arrhythmias to try and improve the treatment protocol.
To develop mathematical techniques and models and apply those to clinical problems, and in particular epilepsy, and then in particular the diagnosis and misdiagnosis of epilepsy.
To develop an understanding of hormone dynamics, particularly on stress hormones that are regulated by the hypothalamic pituitary adrenal axis.
I decided to apply for the fellowship because I had a research idea and I had some skills to develop it, but not all the skills I needed, and I think this fellowship was the perfect opportunity to develop my skills further, to not only develop this project but prepare me for my future as independent researcher.
I decided to apply for the fellowship because I wanted to set up my own independent research career and have all the opportunities that comes with that.
I decided to apply for the fellowship because during my PhD here in Exeter I really became convinced that the work I was doing had potential value.
I did a master's in neuroscience and I did my PhD in epigenetics, so my background is mainly wet lab.
Before I applied for my fellowship, I did my undergraduate degree at Queen Mary, University of London in biology with psychology, and then I undertook my PhD at King's College London in computational cardiac electrophysiology.
So I was doing a PhD here in mathematics at the University of Exeter, and before that I did masters and bachelors in applied mathematics back in the Netherlands.
So I recognized that I needed to develop skills in the laboratory, such as working with zebrafish embryos for this project, but I also needed to develop some quantitative skills, such as integrating different types of data.
Mainly machine learning, so I have no background in machine learning, and it's something that I'm going to need to use to be able to locate these optimal ablation lesion sites.
The skills I recognize I need to develop as part of my fellowship relate to molecular and cellular biology techniques that I need to carry out with my experiments to inform the mathematical models that are part of my project.
This fellowship gives me the time, space and resources I need to work with collaborators and visit other laboratories to develop the skills I need for this project.
My fellowship is helping me to develop these skills because I'm able to work with people in the computer science department here at Exeter. So I'm working with people who can help me develop those machine learning skills.
The fellowship is helping me to develop these new skills by fully funding a research stay for up to a year in a world-leading lab where I will learn and train in these experimental techniques that I'm needing at the moment.
So what's so great about holding your fellowship here in Exeter? Well, first of all, you're going to be based here in this fantastic interdisciplinary research institute, where you'll have the opportunity to interact with a number of world-class investigators who will come up with a bespoke package of mentoring and support for you. You'll be based here with a number of other MRC Research Fellows. We currently have 5 other Skills Development Fellowship holders as well as 2 Career Development Award holders. So you'll have a great opportunity for peer-to-peer learning as well as support from colleagues. We'll work with you to identify a world-leading second research centre for you to further develop your skills and expertise. At the moment, some of our fellows are working with global top 100 institutions such as the University of Michigan and the University of Melbourne There's a great opportunity to grow your international network of collaborators and to take those important next steps in your career.
So in this fellowship I'm collaborating with Dr. Eduardo Santos, Professor Jonathan Mill and Professor Stefan Schaub here at the University of Exeter. I'm also collaborating with Eli Lilly as my industrial partner.
I'm working with Professor John Terry here in the LSI. I'm also working with Jonathan Fieldsend in computer science at Exeter, as well as Dr. Glyn Thomas, who's at the Bristol Heart Institute, and I'm working with his team of clinicians to get data and learn all about the clinical aspect of the project. And hopefully if we can get some software produced, we'll be working with Bioscience Webster, who are a subsidiary of Johnson & Johnson.
For the clinical data, I am collaborating with clinicians both in London at King's College Hospital as well as in Melbourne at St Vincent's Hospital. And they really helped me to get a good grip on what is routinely done in these hospitals and what kind of data you can expect in a normal pipeline.
I will be collaborating with the Henry Wellcome Laboratories for Integrative Neuroscience and Endocrinology at the University of Bristol. And also I will be traveling overseas to Professor Gordon Hager's lab at the Laboratory for Receptor Biology and Gene Expression, which is in the National Institutes of Health in the United States.
I decided to do my fellowship in Exeter because it is a university that is expanding and has a wide range of experts that have the expertise I need for my fellowship.
I chose to undertake the fellowship at Exeter because of the interdisciplinary nature of the LSI. Everyone is so friendly and welcoming here, and if you envisage where you want to do your scientific research, it's in a place where people can share ideas and create networks of researchers.
I chose Exeter instead of anywhere else because over the last few years I think here in Exeter has become the best place to hub for computational modeling and analysis of neurological diseases, but in particular epilepsy.
I'm really looking forward to develop new skills and work with a wide range of collaborators, but particularly I'm very looking forward to establish myself as an independent researcher.
I'm really excited about testing the potential for prognosis of my methods and techniques. So diagnosis is something that I've really strongly focused on.
What I'm looking forward the most during my fellowship is to develop the quantitative skills and experimental skills to become a multidisciplinary researcher.
Finally, we'll be giving you a £5,000 budget for further training opportunities so you can identify these as you go through your fellowship, and it will give you the opportunity to take advantage of opportunities that you might not be able to predict right now. So how do you apply? It's really important to reach out to us before submitting an application. We'll help ensure your suitability and to put you in contact with potential supervisors who can help guide your research challenge and begin to frame your training needs. You'll then need to complete our application, which will form the basis of shortlisting. If you're successful at this stage, you will then attend an assessment day here in Exeter where you will meet members of the team as well as be interviewed by our host leadership team.